If you have chronic back pain, please listen to this. What if I have back pain and foot pain, but the MRI didn't show nerve impingement? So I talk about this a lot, is that an MRI is more misleading and inaccurate than most people realize. Remember, it's taken in a position of comfort. Typically you're lying down, you're not moving, you're not twisting, you're not putting weight through it, you're not doing the things that are often reproducing your symptoms. Additionally, they're looking for large changes in your MRI, and they're actually not paying attention to the small changes that naturally occur in your spine throughout lifetime, which is degenerative disc disease, small herniations, spinal stenosis. They're looking for something glaring. And then finally, they can't see nerve compression on an MRI if it's not there. What I mean by that is that if you're lying down and that space is open and not putting pressure on a nerve, and when you stand up, that space is compressed or the disc is putting pressure on a nerve, they're not gonna see that. They're not gonna see those changes. There are so many other issues with an MRI, but at the end of the day, just know that your MRI isn't the be-all end-all. Yes, it's the gold standard of imaging for this, but imaging is very flawed. What matters more is your symptoms, where they are, when they are, what you're doing, what makes it better, how you move, and then finally, if somebody's putting pressure on those areas of your spine, is it stiff? Is it painful? For me, that is a much more accurate and clinically relevant depiction of you and your symptoms than a static image taken in a position of comfort.